Why does a hair transplant take a full 12 months to show final results when the grafts are placed immediately? The answer lies entirely in cellular biology. During the first 5 days, surgical trauma naturally triggers an inflammatory cascade. You will see redness and swelling because blood flow increases to deliver nutrients and immune cells for initial wound healing. From Dr. Caymaz's clinical perspective, this early tissue response is strictly expected biology, meaning visible redness is never an immediate sign of failure. By weeks 2 through 6, the transplanted shafts typically shed. Follicles redirect their cellular energy away from the hair shaft and towards securing their root structure. Around month 1 to 3, follicles enter a synchronized resting phase called telogen. During this dormant period, angiogenesis occurs as the tissue establishes new microvascular blood supplies in the recipient zone. As Dr. Caymaz frequently reminds patients, understanding this resting phase prevents unnecessary anxiety during the 3rd month when the scalp still appears bare. Eventually, follicles transition into the anagen growth phase, synthesizing new keratin structures. Final visible density and shaft thickness mature around the 12-month mark. In practice, Dr. Caymaz stresses that while graft survival can reach up to 98%, the underlying tissue dictates the pace. Patience is strictly a biological requirement,